Thank you. I will try to share my screen. Can everyone see that? Is it? Yep. Okay. All right. So, like Kelly said, I'm Sheena Sayers. I am the State Opioid Response Program Director for Behavioral Medicine and Psychiatry at WVU. So we will talk a little bit about our mobile unit and then how we have worked to do some rapid HIV testing. We have our mobile unit. It's called Healthy Minds Mobile. So we'll get started. So a few disclaimers and things from the Maytech group are on here. I'm just going to kind of briefly go over them. And then, so the only disclosure I have is that our actual program is funded through SAMHSA and the Bureau of Behavioral Health. So anything I say today is not necessarily what they're implementing or anything of that nature. Uh, Sorry, my things are going slow. So, as Kelly said, I'm on the mobile unit currently in our exam room. We have patients coming in 30-ish minutes, so I'm going to try to get through it. And then, but if there's any questions, feel free to just unmute and ask along the way. And if I have to jump off really quick at the end, feel free to email me or call me at any time. So on our Healthy Minds mobile unit, we provide substance use disorder treatment. So we have group-based settings that we do medication for opioid use disorder and group therapy. Usually, we usually have two groups on Thursday afternoons. We also come out and just on the other one other day of the week and just help link patients to other healthcare needs. We provide like basic wound care. We do urine drug screens and blood work on site. We link patients to primary care appointments, psychiatry, and all sorts of things. We are currently coming out in Morgantown to Hazel's House of Hope. Some of you may not have heard of what that is. So um, they have like multiple social things all in one like location. So there's the homeless shelter, Salvation Army, Catholic Charities, um, Aspire, which is a sober living, all under one roof. Um, and so we come out and we really do serve the underserved population. So instead of trying to get them to come to a clinic, a brick and mortar location, we actually bring services to them. Um, so that's kind of the quick overview of what we're doing out on the unit. Um, we have also started working and collaborating with the WVU Positive Health Clinic. So they have been able to come out and really work with us and provide rapid HIV testing. So I'll talk about that a little more in a minute to advance. So these are just a few pictures of our unit. If you're ever in Morgantown or soon, wherever we take it next, feel free to come out and see what we have and how we're offering it out here. Um, so like I mentioned, we're working with the Positive Health Clinic. So we currently are not trained to actually do the rapid HIV testing. So they come out and help us. They provide all of the supplies and everything, and they actually conduct the test. So, on days that we plan on doing the rapid HIV testing, we promote it days in advance. We put like flyers in Salvation Army, the homeless shelter, etc. So people know that it's going to be here and be available. And then obviously testing is completely voluntary for them, so we don't force any of our patients to actually do it. So, our very first rapid HIV testing day, um, we did a lot of patients. It was in, mm, now I can't remember. I think it was in mm, June, maybe. And so it was also a warm day. But we have done three events with a total of 82 individuals tested. Some of them were tested twice as long as they were 90 days apart. We had three that were known positives. One was a false positive, which was validated to be negative, so a total of 79 negatives. We kind of anticipated that a lot of them would be negative, just because of the location and in West Virginia, as it's a not as a higher prevalence. Um, there's not a lot of HIV testing done in West Virginia, so we were excited to start offering this. So our first test that we did was the INSTI HIV rapid test. It's a finger stick. They get the results in less than 5 minutes. One issue is that it is only safe everything right outside of our unit. So as the summer went along, it was hard to continue the INSTI test just because of the temperature constraints. Um, if a positive was shown from the INSTI test, there was another additional test used to validate if that positive. And then if there was a positive, we would obviously refer them to the Positive Health Clinic or other healthcare provider of their choice. So, if the INSTI was positive, we would do an additional test, like I mentioned. So we did the Aura Quick test, which was also another blood stick or finger stick, and it took a little over 20 minutes to get the results. One of the medical assistants from the Positive Health Clinic would bring the patient into our unit and actually do that on them at that point in time. As this summer got hotter, we did another form of the Aura Quick test, which was an oral swab. So patients could actually collect their own specimen. Um, One of the fallbacks of this, they weren't allowed to eat, drink, smoke, use any like oral hygiene, brush their teeth, mouthwash for 15 to 20 minutes prior to the test. So, one good thing, it was more stable in higher temperatures and patients could do their own specimen. But the fact that they had to sit outside in front of us for 20 minutes until they were able to get the results. Um, and then obviously the no eating, drinking, etc. was also difficult. So we had to make sure that they sat there if they just had a drink before um, for 15 minutes. Um, I know I kind of mentioned this a little bit about if the result was positive. So sometimes we would get false positives. Um, and we kind of expect false positives um, in West Virginia. So um, if the initial test was positive, we did conduct the second test. Well, not we. I want to say the Positive Health Clinic. Um, And then, like I mentioned, if the second test was positive, we would they would need additional blood work to actually diagnose HIV. And that occurs if we at the referral time, whenever they would go to the positive health clinic or other healthcare provider to get that additional testing, and then continued care. Um, so I've gone really fast, I feel like. So some of our future goals for the mobile unit, we do want to and plan on expanding to other locations besides the Hazel's house in Morgantown. So our goal is to go to Marion, Taylor, and Preston counties. Um, we also hope to do additional rapid testing days. I know it's cold now, so instead of doing outdoor tests, our goal is to try to do it on one of the days that we already come up here and do it inside the mobile unit. The front space of our mobile unit actually has a room that actually extends out, and so we actually have room as like a for when we do groups. So we would be able to set something up there and then be able to come back into the exam room if additional testing is needed. Um, then we hope to actually get our CLIA waiver updated so we can actually run the tests and the Positive Health Clinic wouldn't have to run them through their CLIA waiver. Uh, and then hopefully soon we will get our clinical team here trained to be able to do the rapid HIV testing. And obviously, always welcome the Positive Health Clinic out to collaborate in any way. But we would then be not require them to be able to do the testing just on an individual basis as our patients come in, or we can do actual testing days as well. So a few links that I looked up some of the information, and you can look up more information on the actual rapid tests. I do want to give a special shout out to Andy Rogers, the director and lab director at the Positive Health Clinic. She has helped organize all of the testing days, everything, and just is a huge wealth of knowledge. Um, And I think that's everything that I kind of had for today. So if you have any questions about our mobile unit, how we work, how things go, or need anything additional, I can take questions, but here's my email address and feel free to reach out at any time. And then I know that they have some additional promotional ads on here. And so this will also be attached to the presentation as Kelly and Chantry send that out. But I'll just go through them quickly. Um, and here's the information for them. If you have any questions, feel free to reach out to them as well. So does anyone have any mobile unit questions? Does anyone that's on here, do you have a mobile unit? Do you do rapid HIV testing, QRTs, et cetera? Anybody in a different location than here in Mon County?
Hi, can you hear me?
Yeah.
Hi, my name is Angela Chapman. I work at Family Medical Counseling Service serving South BCC and PG County, Maryland. And yes, we do have a mobile unit. We do rapid IV testing as well as other STIs. And then we have a red carpet service for anyone who tests positive so that we can get them immediately linked to care. And I believe they go out there. I'm the nurse care coordinator, and I manage the nurse-led prep program. I'm not out with them daily, but for when I'm not out with them all the time. I spend time with them when we do specific outreach. But I believe they are out daily testing the community.
That's
Sorry, I
awesome.
sound congested. I'm getting over pneumonia. Sorry if I sound
Oh
weird.
no. But that's awesome. That's super exciting, especially that they go out on a daily basis. So currently we're going out twice a week, but hope to eventually make it a full-time every day.
Hey,
We
Sheena.
also had, sorry, go ahead, Jennifer.
Hey, Sheena, it's Jen Boyd. How are
Hey,
you?
I'm
Hey,
good. How are you?
good. I'm sorry I had to miss the beginning of your presentation because of patients. So you may have covered this, but so we aren't currently making use of a mobile unit here at New River, but I tried to work with Maytech to do the INSTI in-house here, just to see if we could increase our rates of HIV screening, and we just decided that the cost was prohibitive. So I was wondering who's funding, not your mobile unit, but the rapid tests, or is it part of the mobile unit funding?
So currently we don't have the rapid tests on the unit.
Oh,
So
okay.
that's where the WVU Positive Health Clinic, when they come out, they bring them, they run them through their CLIA waiver, all of that. Our
Oh,
goal is to eventually get to be able to have them on the unit, um, and working on some funding for that. So I can definitely, as things move along with that, I can definitely let you know.
yeah, let me know because I'd be interested in doing a pilot here with, one clinical team to see if we could increase rates of screening in-house, not even on a mobile unit. And
Yeah.
but I I can't really justify the cost right now. So anyway, thanks.
Sheena,
Hey.
hi, it's Andy. Hey, Jennifer, I have an idea. I mean, because the Positive Health Clinic, I mean, our relationship with the Healthy Minds Mobile Unit and Sheena has just been, I mean, it's been great for us to be able to reach this population. We would not be able to reach this population if it wasn't for the vulnerable population. We wouldn't be able to do that if it wasn't for Sheena and her team. So, since you're in the southern part of the state, right?
Right.
I wonder if it would be, I wonder if reaching out maybe to Christine Teague at the director of the Ryan White program at CAMC, I wonder if they would be willing to work with you. Maybe they would be willing to work with you, their Ryan White program to get some rapid testing done, because especially for this population, that 1 minute test makes it's a game changer. I mean, people are willing to get tested because, especially if they're coming in for a syringe service program or harm reduction program, they're willing to get tested because it doesn't take very long. They're willing to get tested and get out and
Yeah.
get what they need.
Yeah. If you could send me maybe through Chantry and
Sure.
Kelly her contact information, I might just try to pursue that. And I would be looking at it just for our general population here. We have a MAP program here, but we pretty much, get a venipuncture on those folks, and we have a pretty good rate of doing that. But I'd love to just somehow do a pilot with one of our clinical teams to see if we could, I mean, yeah, see if we could increase our rate of testing for the general population. So thank you for that.
Yeah. Oh, the other thing I could think of that immediately comes to mind is you work with Dr. Feinberg sometimes.
Oh, yeah.
Yeah. So she's pretty, you know, she likes to think outside the box. So
True.
maybe she could think of some ways to
Yeah, maybe she's aware of funding or something like that that could.
yeah,
I just
or
think it'd be a fun thing to see if it's point of care testing as opposed to take this order, go across the lobby to LabCorp. And, if part of it is including the nurses in the, in the process, in the flow, and having the nurses do it, does that increase? How much does that increase? So anyway, okay, great suggestions. Thank you.
Jen, just really quick, would this just be some of your general patients, or
Yeah.
would you try to do it in your like coat groups?
No, no, it would just be the general population. We have
Okay.
pretty good success rate. Like our screening with our code population is probably like, well, it depends on how long you talk about it. Probably by their first month of enrollment, we're at 75% of those people getting screened, and by 3 months we might be at 100%. But
Wow,
our
great.
general population, we're much lower than that, to say the least.
Yeah.
We had a comment from Kevin McCoy. He said, we have a fleet of over 60 vehicles and 6 clinics. And he said 50-foot RVs, campers, vans, trucks, and jeeps.
Wow, that's awesome. Where are they located?
Oh, Pennsylvania.
Pull this up here yet. So we've got 6 clinics. We have one down in Washington, Pennsylvania. So we actually operate in Morgantown. We do events at Babylon. That's the nightclub there. So we have testing events as far away as West Virginia. West Virginia patients can come see our clinics, like a Washington, PA, get on prep or treatment, things of that nature. Aliquippa, Pennsylvania, which is north, Erie, Pennsylvania. We're about to open one in Harrisburg, Pennsylvania, and then we're opening a new clinic, a huge clinic in Columbus, Ohio, Cleveland, Ohio, and here in Pittsburgh in the North Shore. Yeah. So we have
Awesome.
vehicles all over. They're small and large. Yeah. And then we do testing events. So that's how we reach a lot of our people. We have a little office at the bathhouse here in Pittsburgh too, just to keep things extra spicy, so people don't have to always just come into our clinic. They can just go to the bathhouse and we'll reach out to them there. So
That's super
that's
exciting.
yeah, that is it is. We do things a little differently, right? So and it's how we're so effective.
Yep.
I think over 1/3 of Pennsylvania gets their prep through us. So we're the largest prescriber of prep, and then we're right now the largest cure of Hep C. So our Hep C team has their own vehicles that they kind of go out and do like Hep C treatment. And our outreach team, they have their own vehicles. They go out, reach people where they are in the camps, if they're in a tent somewhere, just wherever that we can find them. And some of our patients operate with air tags with Apple, so we can find where they're located that way if they want to operate with that program. So it's really effective way to reach people. So thank you for listening.
That's
Absolutely.
Yeah.
amazing.
That is
Yeah.
so amazing.
Dr. Lane has an amazing staff here. We all think very highly of her, to say the least. Yeah. The question is, did we purchase the AirTags? I could not tell you how any of that works. I am a simple sociologist, working as a housing case manager. So I know nearly my boyfriend is the IT guy, and that was one of his projects, the AirTags. So it's been very, very popular, very effective program, to say the least. Hey, Kevin with Columbus Public Health and Central Outreach Mobile Units have been amazing. Thank you. Thank you for that, Alyssa. We appreciate you guys. We're excited to have the new clinic open soon. They keep saying 2 weeks. It's like the movie, The Money Pit, the house. It's 2 weeks, two
Oh
weeks.
yeah. We
So
did a
should be open sometime anytime now, eh? Yeah.
Yes, we did a quick walkthrough a couple weeks ago, and it was
Oh,
still a little bit of with Mimi, the amazing physician there. So yeah, I was going to shout you guys out anyways for your mobile units as you
oh,
kind of asked too. So it's
thank
been
you.
what, gosh, 2-ish years that I think the mobile units have been here at the
I-
Columbus
In
location.
Ohio,
Yeah,
yeah.
Um,
I worked at the
and
Pride event last year, so
oh, good.
I was at one of the big RVs. Yeah.
Yeah, I will say, I don't know if you mentioned it, Kevin. So also with these mobile units, they do ART, which has been incredible, to be able to do that, in the community for folks.
Yeah,
Finding folks that are newly diagnosed or out of
right.
care, has been incredible. So, but I'm glad you're on the call. I wanted to shout you guys out anyway.
Oh,
So yeah,
thank you.
yeah.
Thank you so much. We're excited. I'll be back for next Pride, so I'll be back in Columbus for the summer. Yeah, thank you. Uh, anyone else? I'm gonna mute myself. If not, I got super nervous. No one else has any questions for me? Okay, I'm gonna remute and turn it back over to the organizers here. Thank you guys.
All right, Taylor, I see you have your hand up. All right, Sheena, do you have your patients coming on?
I heard somebody come in the door, but I think it's still one of our clinicians. So
All right, does
any
anybody have any questions for Sheena before she has to go? All right.
All right. Well, thank you guys so much. Thanks for having me. Sorry that I ran through it so I could jump off, but if there's anything else you guys need at all or have questions, let Kelly or Chantry know, and I am more than happy to try to answer anything. So thank you guys.
Thank you so much, Sheena. Have a good rest of your day.
Thanks, you too.